Welcome back all of you to the mock test explanation series for Government Nursing Officer exams. Let us go to the questions now. The first question, which drug is given to prevent bradycardia during surgery? The options, option A, adrenaline, option B, atropine, option C, Fortwin, and option D, lignocaine. The right answer here is, let us see the right answer. The right answer here is option B, atropine. Atropine is used to prevent bradycardia during surgery. Atropine is an antidote for cholinergic agents. Atropine is an anticholinergic drug, so it will be using as antidote for cholinergic agents. As per the ACLS guidelines, atropine is used in the bradycardia. In the bradycardia algorithm of ACLS, atropine is already there. We will discuss the algorithms and ACLS topics later on in this session. Next question. HELP syndrome is a complication of option A, leukemia, option B, hepatitis, option C, preeclampsia, and option D, AIDS. Let us see the right answer. The right answer is option C, preeclampsia. HELP syndrome is a serious pregnancy complication. It is a variant of preeclampsia that affects the blood and liver. See the expansion of HELP syndrome: hemolysis, elevated liver enzymes, and low platelet. That is HELP syndrome. Next question. Priority interventions in Guillain-Barre syndrome is option A, maintain nutritional requirement, option B, assist in ADL, option C, maintain airway and breathing pattern, option D, fall risk prevention. Let us see the right answer here. Here the question is for the priority. So the answer here is option C, maintain airway and breathing pattern is the priority. Priorities and guidelines, as we already seen in application level questions, ABC protocol, life-threatening conditions, and nursing priorities should be addressed first. Here, already there is an airway breathing component is mentioned here, maintain airway and breathing pattern. So this will have top priority for the implementation phase. So airway and breathing should be addressed first, then only the nutritional requirement, assisting activities of daily living, fall risk prevention, etc. will come. Next question. Which condition is also known as trisomy 21? Option A, Cushing syndrome. Option B, Addison's disease. Option C, Graves' disease. Option D, Down syndrome. Let us see the right answer. The right answer is option D, Down syndrome. Trisomy is a genetic disorder in which a person has 3 copies of a chromosome instead of 2. So normally there is a 2 chromosome copy, but here it is 3. So the common trisomies are trisomy 21 is Down syndrome, we already mentioned in the question. Trisomy 13 is Patau syndrome. Trisomy 18 is Edwards syndrome. So 13 is Patau and 18 is Edward. Trisomy X is XXX female with extra X chromosome. Klinefelter syndrome is XYX male with extra X chromosome. Next question. Ascites occur due to option A, hyperalbuminemia, option B, hypoalbuminemia, option C, hypovolemia, option D, hypervolemia. Let us see the right answer. The right answer here is option B, hypoalbuminemia. Ascites primarily occur due to hypoalbuminemia, which means a low level of albumin in the blood. Here in liver cirrhosis, there is hypoalbuminemia, and that will result in ADH hormone interruptions. Then it will result in sodium and water retention, which will further cause formation of ascites. This is the cycle. Next question. Which one of the following is the master gland of the body? Option A, adrenal gland. Option B, parathyroid gland. Option C, thyroid gland. And option D, pituitary gland. Let us see the right answer. The right answer here is option D, pituitary gland. Pituitary gland is also called the master gland because it controls the working of other endocrine glands. Which eye structure receives stimuli and sent to the brain? Option A, retina. Option B, sclera. Option C, legs. Option D, iris. Let us see the right answer here. The right answer here is option A, retina. Retina converts lights into nerve signals. Let us see the other portions mentioned in these options. Sclera, the white of eye. You can see here, this is the white of eye. It will support, protect and anchor the eye structure. So, sclera will support, protect and anchor the eye structure. Lens, it will focus the light into the retina. Lens will always focus. Iris. Iris is the black area. You can see the black area of the eye. So, it controls the amount of light that enters the eye by adjusting the size of pupil. So, these all are the different functions. Next question. The main characteristics of scientific research is option A, experimental research. Option B, historical research. Option C, empirical research. And option D, theoretical research. Let us see the right answer. The right answer here is empirical research. The main characteristic of scientific research is empirical research. Empirical is based on the observations, experimentation, systematic, and follows orderly and sequential procedure. Next question. The anti-sterility vitamin is known as option A, vitamin E. Option B, vitamin A. Option C, vitamin D. Option D, vitamin B. Let us see the right answer. The right answer here is option A, vitamin E. Vitamin E is also known as anti-sterility vitamin because it is essential for the reproductive health in both men and women. So, vitamin E is anti-sterility vitamin. It is found in nuts, seeds, vegetable oil, leafy greens, fruits, etc. So, other vitamins we can see, vitamin A is very important for the vision, growth and immunity. Vitamin D is very important for regulating the absorption of calcium and phosphorus. So, vitamin D is essential for the absorption of calcium for the health of bones. Vitamin B complex is vital in brain function and cell metabolism. Next question. People who are organized and have strong sense of duty are considered as a personality type of option A, extraversion. Option B, introversion. Option C, openness. Option D, conscientiousness. Let us see the right answer. The right answer is option D, conscientiousness. Conscientiousness, the person strives to do what is right and to carry out his duties. So, this kind of people show care and put big efforts. For example, a conscientious doctor will do everything possible to help a patient. So, this is a good quality for a professional. Next question. Which cranial nerve is affected in a Bell's palsy? Option A, cranial nerve 9. Option B, cranial nerve 4. Option C, cranial nerve 7. And option D, cranial nerve 12. Let us see the right answer. The right answer here is option C, cranial nerve 7. Bell's palsy, it is a condition characterized by sudden weakness or paralysis of the muscle of one side of the face resulting from dysfunction of the facial nerve, that is nerve number 7. Bell palsy will include drooping eyebrows, drooping eyelids, facial nerve is affected here, and drooping of corner of mouth is also added here. So you have to see the number of the nerve. Nerve number 7 is facial nerve. You have to remember the chart of cranial nerves. Here the color codes and numbers are given here for your better memory. This chart is already discussed many times. I will just quickly go through this chart. The green color is for sensory nerve, the blue is for motor nerves, and the mixed color is for mixed nerves. So the numbers are also given here. You can see the 7th is facial nerve. This is the mixed nerve, this is the facial nerve. So Bell's palsy is affected by the facial nerve. So you have to find your own ways to remember these things in a better way, because lot of questions can be asked from these topics. Next question. What is the other name of delusions of persecution? Option A, paranoid delusion. Option B, grandiose. Option C, passivity. Option D, infidelity. Let us see the right answer. The right answer is option A, paranoid delusion. Delusion of persecution is a false belief that others are trying to harm me. So the person is thinking that others are trying to harm me. So that is the delusion of persecution. This is also called paranoid delusion. The delusion of grandeur is also called grandiose or expansive delusion. Delusion of infidelity is otherwise known Othello syndrome. Othello is a Shakespeare character. You have to refer that. So that is delusion of infidelity is Othello syndrome. Delusion of passivity is delusion of control. Next question. Removal of an entire lung is known as option A, pleurectomy. Option B, pneumonectomy. Option C, bullectomy. Option D, lobectomy. Let us see the right answer. The right answer here is option B, pneumonectomy. So see the different terms here. Pneumonectomy is the removal of entire lung. Pleurectomy is removal of part or entire pleura. Bullectomy, the removal of air pocket in the lungs, that is bulle. So removal of air pockets or bulle is called bullectomy, and lobectomy is removal of a lobe of the lung. Next question. How many seconds is the normal duration of a cardiac cycle? Option A, 0.6 seconds. Option D, 0.10 seconds. Option C, 0.4 seconds. And option D, 0.8 seconds. Let us see the right answer. The right answer here is option D, 0.8 seconds. The cardiac cycle or heartbeat is lasting about 0.8 seconds. It will include, a cardiac cycle will include atrial systole, ventricular systole and complete diastole. Atrial systole is 0.1 second, ventricular systole is 0.3 seconds and complete diastole is 0.4 seconds. So together with this complete atrial systole, ventricular systole and complete diastole is 0.1 plus 0.3 plus 0.4, that is 0.8 seconds. Next question. Pleomorphism can be seen in which disease? Option A, rubella. Option B, typhoid fever. Option C, chickenpox. Option D, dengue fever. Let us see the right answer. The right answer here is option C, chickenpox. Pleomorphism is seen in chickenpox. It is the appearance of two or more distinctly different forms in the life cycle of some organism. That is pleomorphism. So the appearance of two or more distinct forms of a microorganism in the life cycle is pleomorphism, which is seen in chickenpox. Let us go to the next question. Next question. A woman who has just given birth to a baby is termed as option A, primigravida. Option B, parturiate. Option C, puerpera. Option D, primipara. Let us see the right answer. The right answer here is option C, puerpera. Puerpera is a woman in childbirth or in the period immediately succeeding. So, the woman who is giving childbirth is puerpera. Puerperium is the time immediately after the delivery of a baby. So, immediately after the delivery of the baby, that period is puerperium and that person is puerpera. Primipara, a woman who is giving birth for the first time, and primigravida, a woman who is pregnant for the first time. So, para is for birth and gravida is for pregnancy. Parturient is a woman who is in labor. So, these all are the terminologies related to labor and pregnancy. What is the shape of anterior fontanelle? Option A, square. Option B, rectangular. Option C, diamond. Option D, triangular. Let us see the right answer. The right answer here is option C, diamond shape. Brachma and lambda. Brachma is anterior fontanelle and lambda is posterior fontanelle. Brachma is diamond shaped, diameter 2 to 4 cm and it fuses at 12 to 18 months. Lambda, posterior fontanelle, triangular shaped, diameter 1 to 1.5 cm and fuses at 1.3 months. For better memory, see this picture. Brachma is in the front place, this is anterior fontanelle, and lambda is in the back side, this is posterior fontanelle. And have a memory tip as well for this. Bad 12 to 18, LPT 1 to 3. So, bad 12 to 18 is a bad time for controlling the children. So, that's what you remember, bad 12 to 18 and LPT 1 to 3. So, bad 12 to 18 is brachma, anterior, diamond shape and fuses at 12 to 8 months. LPT 1 to 3 is lacta, posterior, triangular shape and fuses at 1 to 3 months. So, this kind of memory tips you have to apply for remembering such questions and topics. Next question. To which position will you change a client with hypovolemic shock? Option A, supine position. Option B, left lateral position. Option C, right lateral position. And option D, Trendelenburg position. Let us see the right answer. The right answer here is option D, Trendelenburg position. Trendelenburg position is used in hypovolemic shock. Trendelenburg position is a variation of supine in which the head of the bed is tilted. So, here it will facilitate the venous return and improves the blood pressure. That's why this Trendelenburg position is used in hypotension, hypovolemia, etc. to improve the venous return and blood pressure. Next question. The eyeball is approximately spherical in shape with the diameter of about option A, 3.0 cm, option B, 1 cm, option C, 2.3 cm and option D, 1.8 cm. Let us see the right answer. The right option is 2.3 cm. Let us see the diagram. An eyeball is approximately spherical in shape and with a diameter of about 2.3 centimeters. Next question. The health belief model was developed by option A, Rosenstock, option B, Lamberton, option C, Hebert, Dunn, and option D, Levell and Clark. Let us see the right answer. The right answer is Rosenstock. The health belief model is developed by Rosenstock and Becker. Health belief model is a theoretical model that can be used to guide the health promotion and disease prevention programs. It is one of the most widely used model for understanding health behavior. Next question. Which is the short-acting glucocorticoid? Option A, betamethasone. Option B, dexamethasone. Option C, hydrocortisone. And option D, paramethasone. Let us see the right answer here. The right answer is option C, hydrocortisone. Let us see the categories. Hydrocortisone is a short-acting glucocorticoid. Hydrocortisone and cortisone is short-acting. Intermediate acting are prednisolone, methylprednisolone and triamcinolone. Then long-acting are dexamethasone and betamethasone. So, important drugs in short-acting category is hydrocortisone. Important in intermediate categories methylprednisolone, and important in long-acting categories dexamethasone and betamethasone. Next question. The statement of belief and ideas which are considered to be true are known as option A, assumptions, option B, extraneous variable, option C, dependent variable, and option D, delamination. Let us see the right answer. The right answer is assumption. Assumptions are beliefs or views which are considered to be true. The thing is accepted as true and that is done without any scientific evidence or proof. For example, here, one captain is assuming that old weather report is reliable. Then his perception is the road is or the seaway is clear for sailing ahead. But the reality is icebergs are further there on the way and disaster can happen. So always don't believe on assumptions. You have to depend on scientific data or evidences. Otherwise, sometimes assumptions can be wrong and it will go to disaster or dangerous things. Next question. First active fetal movement perceived by the mother is known as option A, internal ballotment, option B, lightening, option C, engagement, and option D, quickening. Let us see the right answer. The right answer is quickening. Quickening is when a pregnant woman first feels the movement of the fetus. Internal ballotment is a sharp upward pushing against the uterine wall with a finger inserted into the vagina for diagnosing pregnancy by feeling the return impact of the displaced fetus. So here quickening, it is the fetal movement felt by the mother or pregnant woman, and internal ballotment is the fetal presence felt by the examiner during the examination of vagina. Then lightening is when the baby drops into the pelvis during pregnancy. It can be also called engagement or baby dropping. You can see the diagram here. Before lightening is just outside the pelvic girdle, and after lightening the baby moves into the pelvis. So lightening is the same term for engagement where the baby drops into the pelvis. Next question. Parkland formula is used in which medical condition as a tool? Option A, bed sore management. Option B, pain management. Option C, burns management. And option D, level of consciousness. The right answer here is option C, burns management. Fluid resuscitation in birds is by using Parkland formula. Initial 24-hour Winger lactate solution 4 ml per kg percentage of burn for adult and 3 ml per kg per percentage of burn for children. So here Parkland is for the fluid resuscitation in burns. Let us see the memory tip and the other options quickly. Memory tip is Park, Burn, Braden, Bed. So burns management is using Parkland formula. Bed sore, we are using Braden scale. Pain, GOPS, NRS, VAS and AVPS scale. And level of consciousness, we are using GCS scale and AVPU scale. Next question. The process of neutrophilic infiltrate in tissues and necrosis formation is known as option A, cellulitis, option B, bacteremia, option C, septicemia, and option D, abscess formation. The right answer here is option D, abscess formation. The process of neutrophilic infiltrate in tissues and necrosis formation is also known as abscess formation. So, Abscess formation is neutrophilic infiltrate plus necrosis, where cellulitis is infection in the deeper layer of your skin. So, infection, especially with the bacterial infection in the deeper layer of your skin is known as cellulitis. Sometimes it can spread to the subcutaneous tissue as well. But here, bacteremia is the bacteria presence in bloodstream. A bloodstream infection that occurs when bacteria enter in the blood is bacteremia. Emia is related to blood always. Septicemia is the sepsis or blood poisoning. It is also known as sepsis or blood poisoning. Life-threatening infection that occur when bacteria, virus or fungi enter into the bloodstream. It can lead to organ failure and even death. So, these all are the terminologies. So, today's portion is completed now. Next mock test explanation series will be continued in next videos. Thank you all for watching these videos, and please like, share and comment your valuable feedback for more exam preparation videos.